Dr. Isley, please tell us your role in the hospital as president and CEO.
So I'm the liaison with the board. I partner with the board of commissioners and their vision and help operationalize that vision that they have for the institution through their interaction with the community. And so I help them facilitate that conversation and then operationalize that. Sometimes they're very explicit and the operations is easily carried out. Other times I have to help interpret that vision and help guide the organization, work with the medical staff, partner with the medical staff and our staff at the hospital, the allied health and the support staff to put their vision and their mission into practice. And so that's really what the role of the CEO does, is to help guide the organization.
Right, and probably, how many years have you been with us now?
4 years.
So 4 years, so approximately about 4+ years ago, the hospital, which was wonderfully managed historically, saw the retirement of the previous CEO, who did a wonderful job. But because of the amazing physical plant that the facility has, which we'll talk more about, the board, in their vast intelligence, really saw the potential for us, and then you elected to, as a board, to partner with UNC because of the advantages of linking with a state-of-the-art teaching facility.
Well, in the previous board, in fact, when Larry Tuning was there, they had already made the decision. I think maybe Vince Andrecchio and Ziggy Zalznick were involved in that decision, among others. But so we already had that in place, which was wonderful. But they help us recruit, they help us interview. Dr. Isley is an employee of UNC, and because we have other jobs and other interests, we needed their guidance and relied on them very heavily to know what we needed to look for. And a lot of that was we needed somebody to take us into the new, rapidly changing healthcare environment. Because as people probably know, our hospital has grown tremendously, but focused on the areas of greatest need in our community. But we needed a visionary. And I'll give you an example. Our leapfrog scores were in the CD range, which means our quality. When Dr. Isley was
CD meaning the letter grade,
the
C
letter
or
grade,
D.
like
so average or below average.
And I have the privilege of chairing the Quality Leadership Council, and we kept getting reports. This is what we're doing, and this way. And we said to Dr. Isley, we don't want to hear what's happening. We want to hear what's being done to make it better.
Right.
And now the last 3 scores for Leapfrog, which is being graded against hospitals across the nation, we've been A. And so he is a very action-driven person. And we, it's been wonderful, because when we ask him to help make this change or help us attack this or tell us how he's preparing for COVID, he's got a great administrative team, and I'd like for him to talk about that too.